So we want to welcome everyone. It is the top of the hour, so we are going to get started. And we're going to introduce ourselves. Hello, good morning, good afternoon, depending on where you're geographically located. My name is Shauna Hasty, and I am the Community Engagement and Outreach Strategist for Region 2. We are located at the Medical University of South Carolina in the Colbert Education Center and Library in Charleston, South Carolina.
Hi, everyone. My name is Benny Finch, and I am one of the Education and Outreach Coordinators with the NNLM in Region 7. We are located at the University of Massachusetts Chan Medical School in Worcester, Massachusetts.
Hi everyone, I'm Sam Nunn. I am the program manager for the NNLM training office at the University of Utah, and I'm happy to be here to support Benny and Shauna today.
And we would be remiss if we didn't also acknowledge Rebecca Brown, who she's under the weather, but she was very instrumental in making sure we were able to have this webinar. And she's also part of the NTO, so we absolutely wanted to include her in the introductions. Today, we'll be talking about connecting older adults to health information. This training is designed to support the needs of libraries, public health workforce, nurses, and community-based organizations. Today, we want to highlight the ongoing work of libraries to support older adults in ways that other professionals might consider partnering with libraries. Libraries provide a convening space that supports engagement opportunities for older adults through special programming, reading groups, and volunteerism. Free access to educational resources, digital literacy training, technology, and social support services to patrons regardless of age, background, or income. And libraries also offer opportunities for intergenerational activities that engages the whole community. Now let's look at our objectives. Today's presentation is going to cover evaluating older adult population data at the local, state, and national level, identifying health information resources to meet the information needs of older adults, and also we're going to look at developing ideas for library and health education programming that address the health information needs of older adults. So next, let's start with some population data. I'm sharing this graph created by the Administration for Community Living taken from the 2022 census data to quickly demonstrate the growth in the number of older adults in the United States over the past century. In 2022, there were almost 58 million older adults in the United States. Of the approximately 330 million people in the U.S. in 2022, 57.8 million were 65 and older, including 32 million women and 26 million men were 65 and over. People 65 and over represented 17.3% of the population, and its projected estimate by 2040 is that 22% of the population will be 65 or older. In fact, 4% are expected to be 85 or older. Now it's your turn. Now I want to give you a chance to look at the percent of the population in your state that are 65 and older. Sam is putting a link in the chat box. It's also on your handout, and we also have put it on the slide so for easier access as well. After you have opened the spreadsheet, look at the bottom of the spreadsheet. There are several tabs. Choose a tab that says state percent 65 plus. Let me know which state you are from and the percentage of the population over 65 in your state in the chat. So we see North Carolina, 17.4. Okay, some are asking for the chat, for the link, 15.7%. Ohio, 18.4, Indiana, 16.9, 13 in Texas, 15.1 in Georgia, 19.1 in South Carolina. So we can see 17.3 in Tennessee. So Beth, I hear you. She says she's shocked on 21.6. So we're looking at so many of the numbers that are varying throughout. We want to thank you for sharing your information about your state in the chat.
It looks like we have a hand raised for Wendy. Wendy, did you have a question that you can add in the chat, or I can allow you to talk? Oh, it looks like her hand was raised or put down, so we're good.
Okay. And please, if there are things, make sure you put it in the chat so we'll know, because we don't want to omit anyone's question, or if they have an issue accessing a link, we want to make sure you have all of those things. Someone is saying handout link, please. Okay, and Sam just shared that as well. Okay. Do most of you all have the link now? Can you just put in the chat yes or still looking? Because I see it's been added. Okay. Okay.
I have to apologize. I realized I was just sharing to the panelists. My goodness, no wonder.
Okay.
My apologies, everyone. Everyone should be able to have the links now.
All right. So do we have the links now? Okay, perfect. Okay, we're okay. I see a lot of yes. So we are grateful for that, so that you have that information. And also just know that all of the links that we're sharing throughout this presentation, you're going to also have that as a participant, so you will have time to review that as well. Now, we're going to look at, from a bird's eye view, our individual states. Here's a snapshot of the percentage of the population of older adults across the entire United States in 2022. The percentage of older adults varies from 11% in some states to 23% of the population in other states. And I basically could kind of see that as people were sharing information from their respective states. Now I'm going to turn it over to Benny, and she's going to demo a couple of websites that can provide health data regarding older adults in your county and more.
Great. Thanks so much, Shauna. So now we have a sense of the older adult population by state, and I find it helpful to get a sense of my local information as well. So I would like to demonstrate two different sites. We are going to take a look at Botetourt County, Virginia, and I chose this county because this is the county where I grew up. And the first site we're going to look at is County Health Rankings and Roadmaps. I really like this site because we can see the data at the county level. So we're going to start here at the top with health data, and I'm going to choose health data by location. And then I'm going to scroll down just a little bit. So you could either choose the state here, or you can type it into the search box. So I'm going to put that county in right here. So that's Botetourt County, Virginia. And here we get a little bit of information on the left. On the right, we can see where Botetourt County is located in the state of Virginia. We can go a little, we can look at some of the data points. Here, there's some general information about health behaviors and health outcomes. You can explore these data points for your own county later, but for right now, what I'm curious about is the demographic data for the county. So I am going to click on this link, Show Demographic Data. And here I can see the percentage of the older adults in that county. So hopefully you can see that a little bit better. So for 65 and older for the state of Virginia, that's 17.2%. But for this specific county, that's 24.6%. So I just want you to see there is some variability of the percentage of the population in different parts of the state. Okay. So now I'd like to take us to a different resource called the Congressional District Health Dashboard. And this is going to cover a slightly larger geographic area. This time I'm going to enter a street address, and I'm going to put in the public library there, which is 19795 Main Street, Buchanan, Virginia. Okay, so this is the address of the Buchanan Library in Botetourt County, which is that same county in Virginia we just looked at. And I'm going to view the district. Okay, so here we see a variety of health metrics, and this is going to be for that entire district, not just for the county. One key thing to know is that this health information is for all ages, not just older adults, but it's still very useful for planning purposes and to explain why you might be choosing an activity or a resource for your organization. You can choose from the different filters here on the left. I'm curious about health outcomes, so I could click on that and I could see some specific metrics. I am also might be thinking about health behavior. So these are things that I might want to pay attention to when I'm looking for programming ideas or when I'm planning for my organization. So I'm going to go back to our slides. So we noted some health indicators in the county health rankings and roadmaps and in the Congressional District Health Dashboard. There are also some common health conditions in older adults across the nation. So this list of the top 9 most common health conditions in older adults in the United States is from the 2023 profile of older Americans developed by the Administration for Community Living. You may notice some common themes, hypertension, high cholesterol, and coronary heart disease are all related to the heart and circulatory system. Arthritis and diabetes are chronic illnesses. We also see cancer and respiratory issues here. So we've looked now at sources of health data about our state, counties, getting that more local data. We have some ideas about health issues nationally. So now let's take a look at some information resources that you can use to answer questions or share with library patrons or within your organization. So I imagine that many of you are familiar with medlineplus.gov. This is one of the premier products of the National Library of Medicine. The National Library of Medicine is one of the National Institutes of Health, which is funded by our tax dollars. I'm not going to spend a lot of time going into all the details about Medline Plus and what's available here. We have other classes and tutorials that go into more depth about Medline Plus, and we do have links to those classes on that handout. But today I want to focus on finding information for and about older adults. So there are some navigation choices here at the top. But I first want to point out that you can turn this entire site to Spanish by clicking on this Espanol button. So that is great if you're working with Spanish-speaking individuals. And we do sometimes get questions about how Medline Plus is translated into Spanish. The Medline Plus Spanish team is made up of individuals who are native Spanish speakers and have experience in health, medicine, and biological sciences. So I just wanted to give you that background. Now I'm going to head back over to the English version. If we look at this navigation bar, health topics is a great place to start. We also see a link to medical tests. You might get questions about those. I'm going to scroll down to the middle of the page and we see those same navigation choices here. And then below that on the left, there's a link to easy to read health information, and that would be for all ages. There is also information, health information in multiple languages, and again, that would be for all ages. And also there is a link here to clinical trials, and we'll come back to that a little bit later. For now, I'm going to click on this health topics page, or link rather, and there are a variety of ways to search or browse on this page. I'm going to choose demographic groups on the right side of the page, and here we see our target audience, older adults. So when I click on this link, I'm taken to a page with approximately 200 health topics that address common concerns of older adults. So just to give you a sense of what is here. Also, I'm going to use this little arrow here on the bottom right, and that'll take us back up to the top, because my preferred way to search is really to use the search box, which is located in that upper right-hand corner of the page. So for today, I'm going to type in high blood pressure. And this is going to launch a search in Medline Plus. You could also search for hypertension, but when I run this search, the top result is high blood pressure, but there are also a lot of other results that have pulled in, and you can see where that information is coming from by looking at the URLs. So just to have that. But for now, I'm going to click on this main high blood pressure link, and it's going to take us to what Medline Plus calls a topic page. All topic pages are laid out the same way. There's a table of contents in this box here at the top, and that is going to include a summary, some start here information, which is a great place to start. And then over here on the right, there are also videos and tutorials, among other things. I do want to point out here on the right, there's also a medical encyclopedia, and that's going to pull in related links to additional information related to our topic. I want to go to the Start Here resources just to give you a sense of what type of things you might find. So the first thing we see is a link to an easy to read article, so that is excellent. Anytime you see this little NIH logo, that means whatever the resource is, it's coming from one of the National Institutes of Health. We also see a camera here, which means that's going to be a video. We can see which ones are available in both English and Spanish. And we also have a couple of resources here from the American Heart Association. Below, we also see a link for diagnosis and tests. The other thing I want to point out here is those multilingual resources. So I want to just show you what that looks like. So I mentioned that Medline Plus is available in Spanish. In addition to this, there is a selection of resources that are available in languages other than English and Spanish. So for example, this handout related to high blood pressure is available in about 12 languages. I am going to show you the Arabic version just so you can get a sense. So this is a bilingual PDF, and that's coming from Health Information Translations. And when we click on that, we get a handout related to high blood pressure or hypertension. We have our English on the left and Arabic on the right, so you can just see what one of these might look like. Okay, I'm going to head back over to our high blood pressure page, get back to the top. So in the research section, or sorry, in the second section here, there's also a link to patient handouts. So these are items that could be emailed or printed. We find that nurses are often particularly interested in these resources for patient education, but these are things that could be used. And again, these are available in both English and Spanish, and you can get a sense of what is available here. Okay, I'm going to use my arrow one more time to take me back to the top. So I know we have a number of people who work in public health. At least half of our group, I think, are in public health and may want to do their own research of the medical literature, or a librarian who might assist someone who wants to research the medical literature. When appropriate, Medline Plus includes a link to journal articles. So we see that here in this research section. I'm going to click on journal articles, and it's going to take us down to that section of the page. And here we find 3 free full text articles. And then there's also a link that says see more articles. So when we click on that, it's going to launch a search in PubMed. But before we go over to PubMed, are there any questions about Medline Plus or anything you'd like to take a look at before we move over there? I'll give you a second. Oh, go
I
ahead.
was just going to say there's no questions related to Medline Plus, but I just answered Ronnie's question about the source for the health condition slides. There's actually in the notes section of the PowerPoint slides, it'll list all the sources we have. So I'll share the PowerPoint slides one more time.
And if I'm not mistaken, and we can send it out if it's not, but I think it's probably also linked in the handout. I think so. Okay. So
Yes,
do
it
we have any
is.
questions coming in about Medline Plus, or should we go on over to PubMed?
I don't see any at the moment coming in, so I think we're good to move forward.
Okay, great. And we can also, we'll certainly take questions at the end as well. So, okay. So PubMed is a biomedical research database, and it's another product of the National Library of Medicine, and it's for anybody in the world who wants to research the medical literature. If you look at the search box here at the top of the page, you can see exactly how PubMed performed the search and what they were searching for. We see a very long search string here. In order for us to get a better view of that, I'm going to click on this Advanced tab under the search box. And this takes us over to the Advanced Search Builder page. If we scroll down, we can see the history and search details, and we can see the search that was run even though we started out in Medline Plus. So we see terms like prehypertension, hypertension, last 1 year. We also see some different types of publications that were included in the search, such as patient handouts, guidelines, clinical trials. And we also see free full text. And that means that your library would not have to subscribe to the journal to access the article. So it's only going to pull in those articles where there's free full text. Okay, so I'm going to go back to our search results by clicking on this hyperlinked number, which let's remember is 192. And this is going to take us back right where we were. So this is a very broad search, and older adults is not part of that search. But on the left side of the page, we do have filters that we can choose. I'm going to click on additional filters. And here we have the option to choose older adults. So we have, I'm going to choose 65 plus. And now we've gone from, I believe it was 192 to 146 results. So that's going to limit it a little bit, and then you can also apply multiple filters. We don't have time today to go into a deep dive of PubMed, but we do teach a 3-part webinar series called How PubMed Works. Each of those webinars is 90 minutes, and we just taught those in November, and the recordings are posted in the NNLM YouTube channel. The classes are also available on demand, and we have another on-demand class called PubMed Essentials, and we've included registration links on the handout. One thing I would like you to know, though, is that you can just go to PubMed and put in search terms, and it will, you can just add your keywords to the search box and retrieve relevant results, and then search details will show you exactly what and how PubMed searched for your topic. Are there any questions about PubMed before we move on?
I don't see any in the chat, so it looks like we can move forward. If anything comes up, I'll let you know.
Okay, great. Thank you. Okay, so we're going to head back over to our page here. I'm going to go back to our table of contents because there's one last resource I want to share here. So this is one more resource from the National Library of Medicine.
Sorry, one
oh,
question
sure.
did come up, and it says, where are the YouTube videos again?
We can
For the
put,
ones.
sure, we can put that. I don't have it, but I can do it in a little bit. We can make sure we get that YouTube channel link in the chat.
Mhm.
Okay. Okay, so you might get a question about clinical trials. So when this particular Medline Plus topic does have a link to clinical trials, they do not always, but I'm going to click on this link and under research to clinical trials, and this brings us to this section of the page. And the first link would run a search on hypertension or high blood pressure, which is the topic we've been looking at. We could also see this link for prehypertension. I'm going to choose our first link because that will run a search on our main topic. So clinicaltrials.gov is a website and online database of clinical research studies and information about their results. The purpose of clinicaltrials.gov is to provide information about clinical research studies to the public, researchers, and healthcare professionals. The U.S. government does not review or approve the safety and science of the studies listed on this website. We do teach an entire class on this website called clinicaltrials.gov for librarians, but of course anyone can register. And that class will provide a deep dive into the website. We're teaching that class in January, and we've put that link to the registration page on the handout if you'd like to register. We also have a class that's offered on demand, and that's also in the handout. But for here, I just want to share with us. So we have, from the search that launched from Medline Plus, we find that there are 1,594 studies for hypertension that are not yet or recruiting trials. So on the left, we can get a little bit more information about our search. We see hypertension listed in our condition disease box. You can add your location here on the left side. We see that they had chosen the not yet recruiting and recruiting studies. You can amend any of these with the filters. You can also use eligibility criteria. And in our situation, we also, again, have older adults that we can choose. And I'm going to choose that older adult filter. I'm going to apply filters. And it takes us to 1,368 hypertension studies that are not yet recruiting or recruiting related to older adults. I'm also going to add a location, and for this one, I'm going to use Houston. All right.
I'm
Houston,
gonna stop you for one moment. There's a question from Karen about, are you concerned with only finding full text articles? You might miss some very good information that way.
That's true. You can certainly undo that filter and just search, yes, especially for other, yes, I 100% agree with you. If you're interested in finding all of the resources or all of the citations that are related to that topic, you would want to not use that particular filter. And that is something you could remove or create your own search without that. But yes, very good point. Thank you. Thanks. Okay. So yeah, thank you for bringing that up. So I'm going to put in a location for our clinical trials, and that is Houston, and I'm going to again apply the filters. And now we have 25 studies. So there are 25 studies related to hypertension in Houston, Texas, that are, again, not yet recruiting or recruiting studies, and they are for older adults. So that's all I'm going to cover in the demos of Medline Plus, PubMed, and clinical trials. As I said before, we do teach classes about each of these resources, and those links are on the handout. Are there any questions about clinical trials before we move on?
Yeah, so we have one from Marie. The site is free to access all clinical trials?
As far as so I am honestly, well, truly not an expert on clinical trials. I do recommend checking out the other classes, but it is free. It's a free NIS. I don't know. I truly don't know if I don't know how the studies are chosen that are included in clinical trials.
And that's something we can actually research and we can actually provide that later. But that is
Yes.
absolutely a good question because one thing that we really appreciate about this space, there may be questions that we didn't think about that we can actually look into for future to make sure we can provide that information additionally as well.
Thank you.
And there is also, not a question, but more of a comment from Lynn. I have found that on the clinical trials website that they don't always update the status for a long time. I just had looked up a trial for someone and it still said recruiting, but had not been updated since last February, and it turned out that it was closed.
Okay, I will find out more about that and try to, when we send out the recording information, we'll try to include some information there as well about how frequently those are updated.
All right,
Okay,
thank you. Those are all the
thanks.
questions for now.
Okay, and so now I think I am passing it back to Shauna, so I'll find the slides. And okay.
Thank you, Benny. So now let's transition into our discussion of programming ideas to consider. Where do we start? We are going to start with our initial planning, which will take in consideration our primary audience, type of outreach, and available resources and capacity. We've already initiated the discussion of some resources to determine your community health needs and some information resources, as well as you have the resources to learn about older adults in your area. And we have reviewed several informational websites and databases. Now you're at the stage where you would identify your intended audience. This may be a specific group of older adults with a specific health condition such as type 2 diabetes. Next, consider the type of outreach or programming that is appropriate for this audience. Keep in mind, health outreach does not mean that you have to provide a 1-hour program with a speaker and activities. Think about the spectrum of engagement and what a manageable and meaningful outreach activity might look like based on your audience's needs. It might be highlighting particular information resources, such as Medline Plus. It might be offering a one-time programming or a series, or it might be offering some training. Finally, consider the staff capacity and physical space you have available and other factors. On the National Library of Medicine's website listing of available courses, we also have a class called Health Programming at Your Library. We have a link to information about this in the handout. And before we go on, are there any, I see some questions or some things in the chat, Sam.
There's no questions.
Okay. All right. All right. So here are the 7 key questions to ask regarding programming. The who, the what, the when, the where, the why, how, and my personal favorite, how much. This slide provides a blueprint of questions to consider for your programming. These questions are all multifaceted, but will help you recognize what pieces you have in place and where you need to fill in the gaps. Let's talk about them individually just for a moment. So let's start with the who. Think about who your primary audience will be. Who in your organization can assist in the programming and the program, and the planning and the program. Who else should be at the table? Who in your community might be an expert or might know an expert? And who are potential partners for this outreach event? Now, let's consider the what. What type of outreach activity do you wish to provide? Will you provide information or will you offer a program with a speaker? What are the community health needs and what evidence of this do you have? What resources are available from the National Library of Medicine or other agencies that you can use? Next, we're going to look at the when. When will you offer your program? When should you schedule programming so that your audience and staff are available? Will this be a one-time or ongoing event? Should it coincide with a health awareness month or initiatives within your community? So absolutely, we think about that. Now let's consider the where. Where will the program be held? Do you have the space? Could this be outreach to a senior center or a local nonprofit? Is it accessible to the participants? Could this be an opportunity for your library to partner with an organization that may have resources that your library may not have at the moment, such as a large auditorium space to accommodate the needs of the participants? Now let's look at the why. Why do you want to offer this outreach activity? Why would this benefit your library's community? This is where those data resources can help guide you. Having the data to support the importance may help to procure funding and other support for your programming. Now let's look at the how. How will you market the program? Will social media or flyers be included in how you advertise programs? How will you measure impact of your program? For instance, will there be attendance taken, pre-post surveys, newsletters, or social media posts? We're going to go back to my personal favorite, how much? This question involves looking at how much time you and other staff will have to invest in the activity and how much money will it cost. Going back to cost, are there partners who are willing to provide a program and or space at no cost? Is there grant funding available? Are there resources you can borrow from your state library or another library if you are a part of a library system? I want to let you know that we've included a couple of resources from the American Library Association that might help you in your planning process, and we'll discuss that a little later.
There's a question in the chat from Robin, and she said, I might have missed it, but is there a way to drill down the data by neighborhood/zip code?
That's a great question. Benny, do you know if we were able to do that from the earlier slide?
You cannot do that from those two applications. From the county health rankings, the smallest increment it goes to is to the county level, and for the Congressional District Health Dashboard, it's really for that entire Congressional Health District. I believe that all of that information is available from the census. It's just, well, I don't know that we have a better tool right now to get to those type, like that full spectrum of the metrics, but a lot of information is available at the census tract level if it's part of the census data.
Thank you, Benny. So let's start talking about getting started with partnerships. Here we have identified some partnerships that libraries in our respective communities have collaborated with. In this chat, please feel free to share some partnerships that your library organization have partnered with, or suggest partnerships that would be ideal for working with older adults in your community. So we're going to give you a little time to add that to the chat. Okay, so someone, local YMCA, MUSC, the American Heart Association, American Lung Association, Alzheimer's Association, partnership with Baycare Hospital. In DC, there's a Retire in Place communities. Recreational centers normally have senior programs. Meals on Wheels. Pharmacy. American Diabetes Association, local health centers. Keep adding nursing homes, libraries. Our universities have some Karen, students working in the free medical program at a local church, hospice, quite a few senior centers. So I'm going to just kind of keep that flowing. These are all good resources that we'll all need at the end. And so as we look at that, you can see some of them are already highlighted. So we're talking about the local government, public health agencies, healthcare providers, food banks, agricultural nonprofits, cooperative extensions, area agency on aging, and senior centers. All provide valuable resources that may have the expertise, audience experience, materials, or other resources that your program needs for success. With an audience, an idea in mind, begin to think about who you might be able to partner with to engage or enhance outreach or programming activity? And does this partner organization align with the overarching goals and objectives of your organization? Additionally, libraries as a program hub for partnerships could serve and provide a platform to expand the population reach of your programming goals. And like I said, I'm still looking at the chat and seeing that you all are very much highlighting some of the great resources that may be available, including faith-based organizations, veteran organizations, and fire department for fall prevention. I like that. So these are some great resources ahead. Now we're going to look at the Healthy People 2030 focus areas for older adults. In the first section of today's presentation, we reviewed the Congressional District Health Dashboard to gather health metrics by district and some common health issues among older adults. Healthy People 2030 is another resource that we would like to highlight as we think about programming and some health topics you might consider. Healthy People 2030 is an ongoing project by the Office of Disease Prevention and Health Promotion. And Healthy Program in 2030, it sets measurable national objectives with 10-year targets to improve the health and well-being of all people. 20 of those objectives are specifically focused on reducing health problems and improving quality of life for older adults. The first People initiative started in 1990, and it's updated every 10 years with health goals and metrics to focus on and track for that decade. Some metrics continue across decades, but priority areas change over time to meet the current health concerns. We thought by looking at the categories specific to older adults identified in 2020 for Healthy People 2030, this might also provide some ideas for programming. I'm sure that you have noticed information requests and needs from your patrons regarding a number of health concerns even on this slide. Can you share in the chat some program ideas from these areas? Even if we're looking at the 2030, I would say example for the oral health, any ideas of specific programs that you all think would be beneficial in any of these highlighted on this slide? I see someone has the Lions Club, does vision screenings at the library. Osher Lifelong Learning Institutes, a university-affiliated programs providing non-credit intellectually stimulating courses, activities, and social opportunities for adults age 50 plus. I'm going to pat myself on the back because it did not scroll fast enough so I could read all of that. So that's great information to have. Chair yoga is offered by our library. Hearing supports, blood pressure screenings, free flu shots clinics, memory screenings. And Courtney said there is a local swim school, usually for kids, started a few water aerobic classes, CPR kits, defibrillators available for checkout, yoga classes, pedestrian safety and driving safety, chair yoga, that came up a lot. I think we may all need to join that one. That was a very good one. Free flu shots again, and AAA offers dementia education and caregiving support. So I just want to thank you, and Narcan demo and high blood pressure kits available for checkout. Like I'm saying, keep sharing that information in chat because I'm sure it's going to be something that maybe some of you on this call could really be beneficial of looking into as well. Now I'm going to pass it to Benny, and she will talk about additional aspects of programming to consider.
Thank you, Shauna. Yeah, it's really exciting to hear all of the really amazing programming that's happening out there and all the ideas that you're sharing. So thank you. So the first type of programming I wanted to cover is collections, passive programming, and reference. So consider starting with a review of your holdings. If you're in a library, what your current collection is, and then seek items to fill any gaps. When we discuss passive programming, what we mean by these are self-directed programs. So this could be things like having a poster in the bathroom about hand washing, or having coloring pages out on a table, or posting a quote or a question of the week as people enter your building. You might want to develop a specific book display for an event or an awareness celebration. You may also choose to provide free printed materials from organizations such as the National Institute on Aging. The National Institute on Aging has several publications you can download for free, and we'll look at some of those in a minute. Maybe there are resources in your things collection you want to promote. We were hearing about some of those things in the last section. Maybe your library offers take and make craft kits. I also hear about some libraries creating kits designed for patrons with dementia and their caregivers on a variety of topics for both entertainment or to support reminiscing or connecting. Reference is another important area. Curated lists of key or sensitive topics and knowledge of community resources will be really helpful here. Perhaps you want to create a LibGuide or a list of resources. Being aware of resources may also help you feel more confident when questions arise. Okay, so the last site I want to demo for you today is the National Institute on Aging, which is one of the National Institutes of Health. In addition to health information on selected topics, it has a lot of resources that could support programming. The National Institute on Aging has tons of resources, and you can follow a lot of different paths to find that information. We've included direct links to the pages that we think are most important in that handout. I'm going to share some of those here, but don't worry about following the specific pathways that I'm going to demonstrate. I do want to go over a few details just from this homepage. The first being that you can shift this site to Spanish by clicking on the Espanol button, so it's available in Spanish. Just glancing at the homepage, there are some choices here in the navigation bar. There's information on healthy aging, Alzheimer's, and more. We also find information about funding opportunities, print publications. So these are examples of things that you could print for your library or organization. These are things that you might hand out at an event or post in your library or maybe have in a brochure rack. You can also browse health topics here. The first one is high blood pressure, so it seems appropriate to take a quick look at that one. So here we immediately see that this page is also available in Spanish. And if we scroll down just a little bit, we get a sense of some of the basic information that's shared here, but also information about what you might download or order for free to include on that topic. Let's head back. There's also information on aging research. There are resources for health professionals, such as tips for improving communication. There are healthy aging resources and more. And then at the bottom of the page, there is a link to alzheimers.gov. So if that's something that would be helpful, that's all there. Now I'm going to use our little arrow to go back to the top. So let's start with this link for health topics. You could also find that here in this tab under health information. So when we open this page, on the right side, there are highlighted topics. If we scroll down, you can browse A to Z health topics. So just to give you a sense of the number of topics that are available here, that might be of interest when you're planning programming or when you're supporting a reference question. Each of those links goes to multiple resources for each topic, like that high blood pressure page we looked at. So I'm going to head back to the top. So we have these 4 key things here that I'm going to cover each of these. So let's start with the featured publications here. So we have some featured publications. I'm going to view all to see what's available so that you might find what you might find helpful or interesting in your community or for your audiences. These are examples of items that you could print. There are also some, we noticed some that are available in Spanish, but I want to point out a specific resource, which is the Caregiver's Handbook. So this is an item that you can download a copy of. On this page, there are also some resources such as online health information, infographics, videos. I'm going to go back to our health information tab and just point out that there's also information for health professionals. I especially want to point out this next one, infographics, videos, and more. This is a multimedia toolkit. There are lots of infographics here. There are publications. We just saw this caregiver handbook. There are videos. So videos might be helpful for audiences who prefer audio or video content over written content. There are also social media toolkits and outreach toolkits. There are scientific images and other resources on this page. So I want to review one of the social media toolkits. I'm going to choose Social Isolation and Loneliness Outreach Toolkit. So this is a very robust toolkit. It includes animated graphics. There are social media images. There are pre-written social media posts. We find an educational flyer. There's health information and more videos. So these are things that you might post on your website or your library's website or include in a blog post or a newsletter, or if you're putting together a LibGuide or other materials, these might be of use. So I just was really impressed by all of the resources that are here. We're going to head back to the previous page because I also want to look at those infographics. So again, this comes from that multimedia toolkit page. So we are going to view all the infographics. So here we find infographics on topics such as your skin, high blood pressure, clinical trials. But I really wanted to point out this one, take care of yourself as a caregiver, because when we talk about older adults, we also think about caregiving. It's going to take a second. Okay, so take care of yourself as a caregiver. This infographic offers some suggestions of ways that one might use to care for themselves when they're caring for others. If we choose caregiving from the, so there are also some links here on the left, and if we choose this caregiving link, we find even more resources. So there are caregiver worksheets. These are things that you could download, print, copy. There are several different articles here on topics related to caregiving. And once more, we're going to head back to our A to Z health topics page. Because I do finally want to share these educational resources and toolkits. So these toolkits are for caregivers, for the general public, for healthcare professionals, and also even toolkits for the media and press and for students. I do want to review this toolkit on caregiving. And the reason I want to do that is because there are certainly resources that we've already seen some. We have a lot of highlighted resources here, infographics, publications, videos, clinical trials, but this is where I wanted to head to, which is the community resources. So if we scroll down a little ways, we find this, and this could be helpful, such as the Elder Care Locator or locating your area agency on aging for your area. And the last thing I want to point out related to the National Institute on Aging is that you can also find health information for older adults in multiple languages. So like Medline Plus, the National Institute on Aging also has resources in multiple languages. So hopefully these will be some great resources for you to use as you're thinking about your programming. Are there any questions about the National Institute on Aging resources before I pass it back to Shauna?
I don't see any at the moment, but if they
Okay.
come up, I'll let you know.
Okay, great. For now, I will pass it back to Shauna. I'll find the slides. All right, thanks.
Hey, Benny. And so now we're going to look back at the types of projects and programs. As we look at the types of projects and programs, we recognize that many of you have either conducted a myriad of programming ranging from nutrition and food access, access to care, social work, or even memory books and memory cafes. We also recognize that there are some in this space that are still at the beginning phase of brainstorming ideas. This is a welcoming space for all, regardless of level of programming experiences. The hope is that through this conversation, we could help generate potential collaborations, provide libraries and organizations with additional resources in their toolkit to strengthen their established programming and or help others inquire about programs that could be replicated to meet the needs of the older adults they serve in their communities. Where do we find the synergy to work together? I like to call that making room for the magic. So there's always a lot of great resources that you all have, and ways that we can kind of incorporate that in the work that we're doing. So never forget the magic. Now, if your wheels aren't turning yet, we have more idea sources. But first, we would like to hear from you. Could you share in the chat about a program you have tried or one you are interested in trying? I saw earlier that someone had that they're in Pennsylvania care kits for seniors or caregivers, and that's one of those things where if you are interested in your maybe state or county, what's in that toolkit? Are there things that could be added that you think may be beneficial? Because it may vary from person to person. Okay, so what does memory books and memory cafe entail? Benny, would you like to share that a little bit about the memory cafe?
Um, I I have not attended a memory cafe. I know that a lot of public libraries and state libraries and sometimes state resources will offer memory cafes. If there are people in the audience who are more familiar with those, if you would please feel free to answer in the chat. We'd love to hear more about those. In terms of memory books, there are I do see books that are specifically written for people with dementia that will talk about a topic like a sport or a place or things like that that people can use just to stimulate memories of things that they've done or pets um, or other content like that.
Thank you, Benny. And so, like I said, this is a group full of rich resources. But if you're still looking for ideas, you may find resources in some of those websites that we have from the American Library Association, which we call ALA. We mentioned. Our focus for this class is health information access, but there are a lot of ideas for other types of programming as well. These programs may even have an impact on the health as people experience social connections and meaningful experiences and interactions in the library.
I
Our
see
Oh,
sorry to interrupt. I see a
sure.
question and it might be related to what Benny was showing earlier.
Okay.
Is there an option on the page to change the font size? I just wanted to address that before it gets too far past in the chat.
I'm sorry. Oh, did I just not make on one of the pages we were looking at?
Yeah, I'm gonna enter the question in the chat again just so I bring it back up, but
Sorry, let me go to the
um
chat. Yeah, I'm sorry. I probably should have. If it was one of the websites, I could certainly have done that.
That was the only
Oh,
question
the
I
National
saw.
Institute of Aging pages. Um, yes, I'm sorry about that.
And so it's really the screen. So I don't think we are able to do it at this very moment. But all of those, like we said earlier, all of those links still will be a part of the resources that you receive and the recording as well. So I'm going to go over a few of the websites here. And like I said, another resource from the American Library. So is the Programming Librarian. You can browse and search library programming ideas. You might search by budget, by age group, search for health, get tips on planning, partners, marketing, budgeting, and other advice for carrying out the program. In the Web Junction Health Happens in Libraries, you can check out their resources list. This is less a list of ideas and more dedicated resources for you to develop health programming, including webinars, communication ideas, detailed examples of projects. It is a deep resource and very much worth exploring to make your health program a lighter lift for you. There's also the Rural Health Literacy Toolkit. This clearinghouse is specifically dedicated to rural libraries with a focus on health literacy. We also have ready.gov, which has emergency preparedness training and programs, social media toolkits, older adults, people with chronic illnesses or disabilities, and people with pets may all have unique emergency preparedness needs to consider. The network of the National Library of Medicine past funded projects. We also have that information, and this link has examples of projects funded by NNLM in the past. While we do not have funding available at this time, you may find some ideas to consider from previous projects. While each website offers an array of great resources, due to time constraints, we would like to take a time to highlight two of the websites. And the first one is going to be the Let's Move in Libraries, and the ready.gov would be the second one. So let's go to the Let's Move in Libraries. Let's Move in Libraries was an initiative that originated from the Let's Move campaign of 2010. The Let's Move in Libraries initiative provided grant funding opportunities to libraries beginning in 2017 that focus on libraries and those within library settings that were responsible for developing programming focused on increasing physical activity and healthy eating programs, as well as providing libraries with actionable steps to develop programming focused on overall health and well-being. As we navigate the program ideas, there are tabs available that help you access inspiration and review recommended actionable items, such as the what costs are associated, things to consider, suggestions for assessment, and how do I talk it up. So it gives you a great resource guide to check into that. As one aspect of this website that we found insightful is that they included testimonials from libraries that participated in the 2019 Jerry Fit program for sustainable active living programs for older adults. Many times we do not get the opportunity to hear from our libraries regarding their experience of developing programming. But in this instance, we have the opportunity to hear what those in library settings felt worked or what aspects of their programs they felt needed improvement. They also had the opportunity to share if they believe their programs could be replicated in other communities that served older populations. The Let's Move in Libraries website also highlights the AARP Community Challenge grant that provided annual funding awards to local projects that help make communities more livable for people of all ages. While there is currently no funding being offered for new projects, they have compiled various summaries of libraries that received funding in the past. And I was very, interested that I saw that there were some libraries in my area that I was familiar with. what I will say about this is using this as a resource, this may present a strategic chance to see firsthand which libraries potentially in your areas that have secured funding and help gather inspiration for the project models they implemented. So now we're going to move over to ready.gov. And once you get to ready.gov, we're going to click on make a plan. And on the website, we're going to focus on the emergency preparedness resources for older adults. So we're going to click on the older adults. And as you can see, and when you review the disaster preparedness guide for older adults, they do have a language in English and in Spanish, just so you know, but under the plan for the emergency preparedness, they provide a checklist that you can review with thinking about, when you're experiencing some type of emergency. You can think about it personally, but also it gives you the outlet of if you're working with these particular populations, older adults, and what resources they may need. What I also like about this actually checklist is they also leave space for you to include additional items to your checklist because they understand the needs of you and your community can differ geographically as well as based on age and other differences. So finally, we would like to share with you some health observances and awareness days that focus on older adults. Celebrating older adults with these monthly observances can further enhance programming, and some national associations and agencies provide additional information and toolkits to help bring awareness to health conditions and celebrate older adults that you can use. And some of these resources are free and or low cost. And you will be able to find links to some of these observances in the handout that is going to be provided. Okay. Now, do we have any questions or answers, any of that right now?
One came in. The PowerPoint slides offer wonderful resources. Thank you. Oh, that wasn't a question. That was a compliment.
But we will receive that. So thank you, Catherine, for saying that. And, because you're a part of this, you will absolutely have access to all of this information, going forward. Let's share the next slide as well. Just on the next slide, we have our information. If you need any additional, of course, my trusted partner in crime, Benny Finch, and myself. And thank you so much, Sam, for stepping in this space. But we kind of want to, and we just want to thank everyone for being here. And then we go to the next slide. We absolutely want to thank the National Library of Medicine, NLM, NLM are service marked of the U.S. Department of Health and Human Services. So, but we did want to open up, we have a few more moments. Are there any questions? I just want to make sure I don't want to miss anything. Okay. Okay. So that's the end of our content for today. The last thing we want to share is the link to the evaluation, which is the first step in claiming your continuing education credit. And I also want to add, even if you're not trying to get any type of continuing education, please leave an evaluation because we want to know what word, how can we enhance it, because this is for you, because we want to make sure when you are doing your partnerships and working with your communities that you have all of the resources that you need moving forward. So we thank you in advance. And Sam, would you like to share with the how they can claim their fees,
Yes.
please? Thank you.
Yeah, so I added the link to the evaluation in the chat. So this class offers MLAC credit for CHIS, the Consumer Health Information Specialization, as well as the Certified Health Education Specialist. So make sure if you want to get your contact hours for CHES as well as your C credit for MLA, make sure you fill out that evaluation form. And there's also a helpful 1-minute video in the handout that shows how to claim credit on MLA's website. And it looks like Jules added a question. Do you have resources for how to have conversations with healthcare providers or insurance companies?
So what I would say in a very honest statement, I would have to research that a little bit, but I do know there are some spaces where they do have that type of information. And I was going to put it back on those in the chat. Are you all aware of any resources that provide a basically easy guide to have conversation with your healthcare professional?
And one thing I wanted to mention again, I already said this in the chat, but there are some people who attended that's really interested in the resources that's shared in the chat. I won't be able to share the entire chat, but I'll pull the information that was shared and put it in a document. And once we announce that the recording's available, I'll also share that document as well. Just wanted to mention that.
Thank you, Sam.
So I also, you might notice I'm kind of playing on the screen, but there are some resources from the National Institute on Aging that I have found really helpful. So talking with your doctor, there's some worksheets, 5 ways to get the most out of your doctor's visit. I'll just open one of these just to give you a sense. So like recording your family history, questions to consider when choosing a doctor. So there are some really nice resources here on this National Institute on Aging website. And also another place, I'll find another Health Finder. I'll stop sharing and I'll find that and I'll share that with you also. Health Finder has some nice resources.
And then I think the slide that you had, just that part, we didn't have a chance to click on it, but I'm sure just like many of those have checklists, I'm sure they had some checklists on those worksheets. So we want to make sure if we can, we'll include that one as well in the resources. So we'll just kind of update that as well. Someone asked about the CEs for public librarians. I'm not sure.
Yeah, I wasn't typing fast enough, but so the Medical Library Association's CHIS is not just for health science librarians or medical librarians. So if you're a public librarian that's interested in getting your CHIS to show that, hey, you can provide health information services, it's definitely for any type of librarian. So you could definitely claim credit through MLA's website for sure. And there was also a question from Jennifer. What about resources for working with seniors who have disabilities such as Down syndrome, vision impairments, etc.?
What I will say is some of these questions may be specific and it may be a deeper dive than the information that we provided today because one thing we know that we have so many participants who are connected from so many different spaces. So we wanted to kind of do a high level of all of the national resources because we know at the local level you may have some of those resources, but we wanted to highlight those resources that like we've previously said, were free or low cost that was, beneficial to all of those across the board. I will say we didn't specifically look into those with perhaps Down syndrome, but there have been resources that we've kind of seen that helps with those thinking about disabilities. And even when you go back to ready.gov, when we were talking about the emergency preparedness space, they actually have a checklist of, working with individuals who have disabilities, working with individuals who are in rural communities. So there are other spaces that may have that information readily available to you as well. Thank you, Haley. Haley says she's going to fill it out after the meeting. We appreciate that so much.
So I dropped a link in the chat for this this is called My Health Finder, and there are some more resources for talking with the doctor that I just dropped in the chat as well. And the other thing I was thinking about, especially for public librarians, many of the state libraries offer a lot of support. And so they might have tools that you could borrow or resources that are specifically available to your audiences as well.
And I mean, we didn't really talk about other resources like social work resources, but there are some libraries that actually have social workers on staff where you can sign up to talk to them, and they may be able to help with other resources that you may need as well. It's basically for any of the patrons that need resources, whether it be help with insurance information or maybe experiencing on housing, but there are other resources in various libraries and communities.
I did want to point out as well on Medline Plus, I take an, sorry, if you go to the sitemap for Medline Plus, there are also, two things. There are directories and there are organizations. So these are organizations that have been vetted by the National Library of Medicine that also offer information on a lot of the things that we've been talking about today. So these are another resource, but you do have to kind of search a little bit for it by going to that sitemap, which is located under the search box on Medline Plus, and then looking for organizations. But that gives a lot of resources from, like, if you're wanting to go to different resources, these are some that have been vetted by the National Library of Medicine.
Are there any other questions or concerns?
I guess I'll just clarify. I already answered in the chat, but if you only want to get chess credit, not MLAC credit, that's okay. You could get both. If you want to double dip, that's fine. How do I put in my code for chess? So I'm assuming this is related to chess. Sorry, I should say the whole name. The Certified Health Education Specialist, that you need your chess ID that's usually given to you by I forgot their name. It's off the top of my head, the national, but there's a chess ID that you would be given. But if you're talking about the MLA Consumer Health Information Specialization, that you don't need a chess or like an ID number. You just have to claim or fill out the form, say you would like MLAC credit, and then you would claim credit on MLA's website. Thank you, Haley. Yeah, they're the ones that offer the chess credit, which would require the ID. And you're welcome to reach out after this webinar if you still have some clarifying questions. I'll add the National Training Office's email so we can address it as well.
I just added my email to the chat, so I'm happy to hear from you afterwards.
Almost there.
Oh, and just I don't know if you already said this, Sam, but sometimes we get questions related to the MLACE. You do not need to be an MLA member to claim that credit. You just need to create a free account on their website, and you go to their website to claim that credit, and you can print a certificate as well.
That's correct. So you just need a guest account. You don't have to be a member with the Medical Library Association. That is correct. And yes, Haley, if you want your chess, just fill out the evaluation form. There'll be a section where it will ask you, would you like chess, mark it, and then there'll be another section for you to fill out. And as I mentioned, you'll enter your chess ID number. It can be easily confusing when you have chess from MLA and then chess. So I gotta get a habit of saying the full specialization name.
Thanks for watching. This video was produced by the network of the National Library of Medicine. Select the circular channel icon to subscribe to our channel or select a video thumbnail to watch another video from the channel.